Hello, I'm Dr. David Barbe, President of the World Medical Association. And in the run-up to the United Nations General Assembly Special Session on COVID, the World Medical Association would like to make this statement. The COVID-19 pandemic has taken a terrible toll on most nations. Millions of people have died, many were taken ill, and many are still suffering at this moment. And many have lasting damage from what is known as long COVID. Fortunately, most people have been able to stay safe with hygiene, distancing, face masks, and in well-ventilated rooms. But for our colleagues, doctors, nurses, and other health personnel, it has been very different. They had to be in close contact with their patients in order to care for them. They had to put themselves in harm's way. At the virtual General Assembly of the World Medical Association just recently, we mourned our deceased colleagues from all parts of the world. We don't know the exact number, but we know it will be many thousands. What we do know is that physicians were among the first to fall ill and to die. Last spring was the worst time when many had to work without proper personal protection and in intensive care units, and as family physicians or public health doctors testing the population. We have received applause and recognition, but what we health professionals now need is a recognition of COVID-19 as an occupational disease with comprehensive coverage of income loss, treatment and rehabilitation costs, and care for the dependents in case of death. Some countries are certainly doing a better job than others. However, this protection must be provided without gaps. Those who are affected need it without delay. This pandemic is still devastating the world, and it is far from over. Even with vaccines on the horizon, it will last for many months to come. There will be a lot of lessons to be learned, but one thing is already very clear. Those nations which were prepared for a pandemic had far fewer problems and victims than those which were not prepared. Some thought that simply having a paper on pandemic preparedness in the drawer would be enough. This turned out to be a fatal mistake. What each country needs is a comprehensive strategy, regularly updated and fully funded. And one more thing is very clear. This was not the first pandemic, and it will not be the last. We must have better investment in healthcare and prevention, and this has to start now. I'm Dr. David Barbe, President of the World Medical Association. Thank you for your attention.